So in this course, I'm going to teach you a new way of thinking about things, or at least it's a new way for most of us because we aren't taught this way of thinking when we go to school. Again, we were taught to think about what's wrong with the person, not necessarily what happened to them. So I'm going to give you a model, which you'll see on your screen. What the model is a new way of thinking about what happened to the person and a new way of thinking about what is going on internally within the person. So in short, something happened. We'll call that trauma. Now, for more detail about trauma, which we'll talk a little bit more about in subsequent lessons, but a little bit about trauma, I refer you to the ACEs study, not ACEs in Accelerated Cognitive and Emotional Solutions, but the Adverse Childhood Experiences study. There's a lot of data, there's a lot of information on it. In short, for our purposes, it said that if certain things happen to a person within the first 18 years of life, and I say usually most of these things that happen that have profound lasting effects happen within the first 10 years of life or so. These things that happen that are traumatic, these are things that we would consider traumatic, like abuse, rape, violence, illness, things that would be traumatic for most of us, but then there includes other things such as having a parent incarcerated, a parent with a substance abuse problem, basically a chaotic family life, abandonment, death of a parent, death of a loved one. There are many factors that are considered traumatic that affect a person. Being bullied, being teased, being shamed, being ridiculed, all these things have lasting, profound effects which continue to cause mental illness, substance abuse, and even a host of medical problems that affect a person later in their life. So the Adverse Childhood Experiences study I refer you to, but understand that when something happens which is traumatic, for many people it has a lasting, profound effect on how they think, how they feel, and how they behave. This effect then causes, as I said, ways to cope for that situation. So as I'm experiencing these things and experiencing this stress, these troubling emotions, I develop ways to cope with it. Sometimes those ways are adaptive and helpful. Sometimes those ways, even though they initially are adaptive, eventually become maladaptive. A great example would be substance use. Well, I'm going through life feeling awful, feeling bad, my life is chaotic, it's crazy, I'm emotionally affected, I'm dealing with all kinds of problems, and one day somebody gives me a drink, or one day somebody gives me a drug, and I notice, wow, it alters the way that I feel. Those negative emotions, all of these problems seem to, at least momentarily, go away. Wow, I've been looking for this stuff for a long time. So I start using it repeatedly because every time I use the substance I feel better. When I stop using the substance I go back to feeling bad, sometimes even worse. So then I pick up and use the substance again. Oh, I feel better. Well, over time what became a solution originally now becomes a problem. It's maladaptive. So if we think of substance abuse in many cases as being an adaptive behavior that turned maladaptive, boy, that gives us a whole different way of thinking about it and approaching it, because what we need to deal with not only is the behavior, substance abuse, but we also have to deal with the origin of the substance abuse, the trauma. If we don't deal with the underlying trauma and the emotions and the thinking and the feeling and all of that that's attached to it, then as soon as a person stops drinking, all of that stuff comes back. Well, when it all comes back, what's the first thing I think about doing? Going out and using again, hence I go relapse. Or it's so awful that before I even have an opportunity to get or stay clean and sober, I go back to using. So that's just one way of thinking about it, but it will be a way that I'm going to teach you to think about it because it gives us a lot of ways to intervene and new methods and approaches to dealing with not only substance abuse, but also with the underlying trauma. When the person has these issues over a period of time and the methods or the behaviors that they've used to cope are no longer working for them, then over time they develop symptoms. These are unwanted feelings, unwanted behaviors. They develop symptoms that we then associate with various disorders. For example, depression, anxiety, other kinds of negative emotions that one feels that produce symptoms and produce negative behaviors. Shame and guilt in particular are at the core of almost all emotional turmoil and behavior. Believe it or not, when I drill down, most of the time the underlying core issue is a sense of shame and guilt. Once we clear up the shame and guilt, then very often the person feels better, their depression, their anxiety, their grief, etc. go away. This particular technique deals with all of those things. So rather than thinking about disorders like depression, let's think about what the mind is doing to cause the symptoms, which then lead to the diagnosis of depression. Or what is the mind doing that's causing the anxiety, which then results in the diagnosis, generalized anxiety disorder or panic disorder or OCD or whatever it is. When I have these unwanted feelings or symptoms, then I have to find new ways, or I continue to rely on old ways to cope with those, and so that just perpetuates the cycle over and over again. Our job and our goal is to determine what is the mind doing to cause these symptoms. What is the mind doing to cause these symptoms? Once we're able to isolate what the mind is doing, then our goal is to alter or change what the mind is doing and shift it to a different way of operating. Once that shift occurs, and that's a shift in thinking, feeling, etc., then the symptoms disappear. So it gives us some question as to really what is the disorder. Is it really a disorder, or is it something the mind is doing to cause the symptom? And once we change the way the mind is working, the way the mind is operating, that produces the symptom goes away, hence there is no more disorder. That's a different way of thinking about it, right? Well, you'll find that as we go along in the course that these new ways of thinking are going to help you and give you some strategies to use that the old method and the old way of thinking just doesn't get to. It just doesn't fit with our new paradigm, our new shift of thinking. Hang in there. It'll all make sense as we go along.